Welcome to Broadband, a super determinant of health. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is co-produced with Healthy Places by Design and is the result of the contributions of many colleagues and partners in Wisconsin and across the nation, including the Robert Wood Johnson Foundation. I also want to acknowledge that the views of the speakers outside of CHR&R are their own. Hi, my name is Erica Burrows-Girardi. I am the Senior Outreach Specialist at County Health Rankings and Roadmaps, and today I'm joined by colleagues who will assist in your learning experience. Let me start by introducing you to Joanne Lee with Healthy Places by Design. Hi, Joanne.
Hi, Erica. Thanks so much for the welcome. And I want to welcome all of our audience members out there. Thank you for being with us. As Erica mentioned, I work for Healthy Places by Design. And in addition to co-producing these national webinars, I also help to facilitate the post-webinar discussion group sessions, which you will be hearing more about in a minute. I first want to tell you that during today's webinar session, I will be managing the Q&A box. So as you have questions for our presenters, you don't have to wait or hold them. Go ahead and put them in the Q&A box. I'm going to be joined by Molly Burdine, who's with County Health Rankings. And Molly's going to help me field some of the questions, and we'll get to as many of them as we can. But I also want to point you now to Tommy Jaime, who's with CHR&R, and he's going to talk to you about how you can use the chat box to participate with us today. Hi, Tommy.
Hi, Joanne. Thanks. And hi, everyone. I'm excited to be here with you all today. And like Joanne said, I'll be chatting with you in the chat box today. So just as a reminder, when chatting, please be sure to use the drop-down box and choose chat to everyone before you send your message. That way everyone can see your chat. And if you have a question, again, please be sure to place it in the Q&A box where Joanne will meet you and hopefully help you get your questions answered. And next up, I'd like to introduce Erin Schulten. Erin is a colleague here at County Health Rankings and Roadmaps, and she'll be helping with technology. If you have any tech issues during the webinar, please let us know in the chat. Hey, Erin.
Thanks, Tommy. Hi, everyone. I'm happy to be joining you all today. If you do experience any technology difficulties or questions, please send a message to host and panelists in the chat box, and we'll see what I can do to help you. Now I'll pass it back to Erica.
Thank you so much, Erin, and thank you to all of my colleagues and Joanne for helping with your learning experience for today. And for those of you who are new to the CHR&R webinar family, welcome, and give me a moment to introduce you to our goal. CHR&R is committed to growing community power to improve equity, and we ask that you join us in that effort. And so therefore, we share data so you can identify who isn't thriving in your county. We point you then to evidence to share what research is working to improve equity. Then we share guidance to help you take steps to action and create change. And lastly, we offer stories to give you real life inspirational examples of what equitable actions look like. And that's what the purpose of these CHR&R webinars are. So our program is comprehensive in that our goal is to provide you with tools and resources to move you from data to action. So that in the end, everyone has the opportunity to thrive, no matter what their zip code is, the color of their skin, age, or any other aspect that makes us unique. Hopefully you want to learn more about what it is that we do. So to do that, please take a look at our CHR&R 101 webinar. You can watch it on demand, and Tommy's chatting out a link to that webinar right now. So now I want to turn your attention to the topic of today's webinar, and I'm going to tell you why we consider broadband to be a super determinant of health. Imagine your life without a computer or a smartphone. Now, for some of us who were enrolled in K through 12 without having access to these assets like me, that's not necessarily a hard stretch. But for others who are younger than me, you'll probably just can't imagine your life without these critical tools. In fact, access to a computer is central to our lives. We use computers for school, work, travel, shopping, banking, entertainment, and more. I mean, you could probably name so many more ways that we use our computers and our smartphones, because we depend on our smartphone more for seeking information than we actually do for talking. So, how limiting would your life be if you simply did not have these tools? You may even have access to a laptop or a phone, but without adequate broadband, these tools become useless or can become useless. So, because computers are so vital to our access to education, employment opportunities, health opportunities, and our social connectedness, broadband is emerging to be a super determinant of health. So, what do we really mean when we say super determinant? Take a look at the four health factors that you see in the blue boxes on our rankings model. These four factors, health behaviors, clinical care, social and economic factors, and the physical environment, influence our health outcomes. Well, broadband access can determine how well we're able to manage those health factors for our lives. So it actually ultimately shapes our health outcomes. Broadband access is arguably one of the most significant equity challenges of this century, impacting residents' opportunities to thrive. And for this reason, County Health Rankings and Roadmaps recently created a data spotlight focused on broadband access to help you explore the complexities of this digital equity challenge. Like, what are those complexities and what are the solutions that we can consider to close the digital divide? So, with that, let me introduce you to today's guest. First, meet Christine Muganda. Now, if you were part of our audience in September, you met Christine because she introduced another data spotlight at that time. She is the CHR&R Data and Analytics team leader. And today, Christine is going to show us how we can locate broadband access data on our website, as well as define a term that was actually new to me before this webinar, and that's digital redlining. She's going to tell us what that means and what its effects are. So, hi, Christine, and welcome, my fellow colleague.
Thank you, Erica. I am grateful to be here.
And now meet Kiran Bains. Kiran is the president and CEO of San Antonio organization rather called SA 2020. Kiran will address what can happen when we create a plan to address digital inequities. And she will also share some innovative ways that multi-sector partners are working to close that digital divide. Hi, Kiran.
Hi, Erica. Thank you. I'm so happy to be here as well and share space with you and Christine.
Well, I'm especially grateful to have you because San Antonio is a 2018 winner of the RWJF Culture of Health Prize. And we have been wanting to highlight this city on one of our webinars ever since then. And we've had like missed opportunities to get you all plugged in, but you're here now. So I am looking forward to hearing about what San Antonio's broadband access work looks like. So thank you so much for being our guest. Now, for those of you who are taking part in this webinar, there may be people that you interact with in your community who probably needs to hear the content of this webinar. It could be community partners that can help broaden access to broadband in your community. It may be colleagues that you work with. It may be elected officials or other decision makers. If you are a Twitter user, please take a moment to invite them right now by retweeting what we just posted at CH Rankings on Twitter. And just invite them to join us now. I'm actually doing this now. I got my phone out and I'm going to retweet it as well. There I go. So hopefully you'll do that for me. Thank you so much. Now, after the webinar, an exciting opportunity to process what you're learning today will be held. We're going to actually have what we call an interactive discussion group to deepen your learning about the content of today's webinar. Now, some of you have been part of these conversations before. You know they give you a chance to be face-to-face with other webinar attendees and share what you're doing locally, as well as ask questions of other participants. We're pleased to be able to offer these sessions in partnership with Healthy Places by Design. Joanne, whom you've already met, will be our lead facilitator, and our guests, Karen and Christine, are also going to join us for that discussion. So Tommy is going to send you details about how you can connect to the discussion group later on in the webinar. And so With that, I want to invite Christine back to the mic because I want to talk about the broadband data spotlight that I was sharing about a few minutes ago. What is the data spotlight showing us?
Thanks, Erica. This data spotlight brings to light the way that communities which are experiencing disinvestment will face layered barriers to health. As a case study, we're looking at Milwaukee County in Wisconsin, and we're looking at how broadband access correlates to areas that are already experiencing poverty, unemployment, and low rates of high school completion. Our analysis shows that areas with low broadband access are often the same as those which were redlined in the 1930s when the federal government intentionally marked some neighborhoods for investors to avoid. Lack of broadband access in these areas creates this compounding effect when layered on top of other current symptoms of disinvestment.
Yeah, I can see how that might happen. So let's talk about exactly what we mean when we say lack of broadband access. Like, what defines broadband access?
Broadband provides a higher speed of internet access. So it's a connection that would allow a user to do things like video conferencing with a moderate speed. Another thing that I'll mention here is that the composition of a household will also impact the need for a robust connection, since even connections that technically would meet the definition of broadband might not be fast enough or reliable enough to support the needs of multiple users simultaneously. And as you've mentioned, Erica, broadband access has become less of a luxury and more of a basic necessity to navigate our society. And certainly the COVID-19 pandemic has only made this truer. Over the course of the pandemic, I've heard stories that have been shared of Americans trying to complete educational or employment obligations in parking lots of libraries or in coffee shops. And then when we look across our country, we see that access to broadband isn't something that's distributed equally. So across the entire nation, 83% of households have connectivity. Among rural counties, the percent of households with connectivity drops to 73%. And this percentage isn't far from the average of 79 households with connectivity within the 10 most segregated urban counties in the US. So we have in both rural counties and in highly segregated urban counties, more than 1 out of every 5 American households lacking access to broadband. And so truly, this is a reflection of where our society has chosen to invest and where not to invest our resources.
Right. And, as I learned about this inequity, I also learned that new term called digital redlining. What is that?
Thanks for opening this question, Erica. And I think there's a lot to unpack here, but let's start with the term redlining. So redlining is a term that was introduced to describe this practice from the 1930s of grading the worthiness of communities to receive investments. So what happened was the US federal government introduced the Homeowners Loan Corporation, which created something called residential security maps. And you're seeing an example here on the screen from Brooklyn, New York. And these maps were intended to identify neighborhoods that were undesirable by these standards and to steer investors to direct their resources toward other communities. The deep problem here is that race and income compositions of the communities were actually core to the determination of the desirability as presented in these maps. So to step through this a little bit, on these residential security maps, communities that are receiving a grade of A were considered the best places to invest, and these were coded in green. Grade B communities were second best, and they coded those in blue. And then we have communities labeled as in decline according to this grading scheme, and these were assigned to a grade of C, and they were coded in yellow. And then communities labeled as hazardous based on this grading scheme were assigned to a grade of D, and they were coded in red. So hence the term redlining. This practice contributed to a cycle of disinvestment where green and blue communities with the most resources were intentionally receiving more opportunities and more resources, while red and yellow coded communities were actively cut off from these same opportunities. I'm going to take a little pause here and really encourage each one of us to visit the webinar resources and to sit for a while with the interactive redlining map from the Mapping Inequality Project. It is jarring and it is heavy to read through the notes that were recorded on these original maps that are explicitly citing the presence of Black and low-income populations as the reason for the hazardous label and for a red line coding. The words that you see appearing on the screen right now are actual quotes from the text that are justifying the color codes that were assigned in the redlining maps. And these words make it very clear how core racism, classism, and xenophobia have been in the determination of community worth and worthiness. And it's difficult to step through the troubling details of our history. But Erica, one thing you and I have talked a bit about this week is hope. And I think that the hope here is that this understanding can help us inform impactful strategies for our collective next steps forward.
Absolutely. And, just seeing that, Christine, which is shocking. I mean, I was like, I knew discrimination occurred. I mean, we knew it existed, but to just see that like written, to know that that was like written policy, it was shocking to see that. And so that resource guide that Christine is referencing will actually be in your email box tomorrow. So you'll have a list of all the resources that Joanne are compiling from this webinar, and we'll get that sent out to you. And yes, I want to underline what she said, or underscore, sit with this tool that you're going to be linked to in that guide, and really just go through it and see and learn like I did. I mean, I was born in Brooklyn, and I see this and I'm like, oh, it's just very, very shocking to me. So, Christine, what does this have to do with, the redlining? Now, tell us what that has to do with broadband.
Right. What does this have to do with broadband? Well, broadband is an investment in a community, and broadband access opens doors to educational and employment opportunities, as you have explained, Erica. Broadband access is associated with higher home values, higher rates of entrepreneurship, and overall better economic health and community well-being. Broadband is a resource that brings in more resources. There are two main barriers to broadband access, that is physical infrastructure, and the second is service affordability. Broadband service providers make choices to maximize returns on the investment of broadband in a community. So this means that communities with more resources are, of course, more likely to receive the investment of physical infrastructure for broadband, opening the door for even more resources and opportunities to flow into that community. But in contrast, communities with fewer resources are less likely to be marked as a good investment for broadband, and as a result will become further cut off from the flow of resources and opportunity. This is the practice we are describing when we refer to digital redlining. And we often speak of redlining as something that's historical, but as demonstrated through the patterns of broadband access, the practice of creating and perpetuating inequities based on anticipated return on investments is something that's ongoing in our country.
Yeah, like I said, all this information was so new to me before we actually started digging into this broadband measure. And so, let's talk a little bit more about the implications for not having access. I mean, I gave it a broad brush earlier, but let's kind of dig into the ramifications of this, because they're serious.
Yeah, and I'll start with underscoring a bit of what you shared earlier, Erica. Broadband access connects communities to these critical aspects of modern life. And as we've discussed, when a household lacks access to broadband, opportunities are lost for education and for employment and for access to really important public resources. And these barriers can impact the ability of that household to access the ingredients necessary to reach their full potential for health. So our data spotlight is challenging us to step back and to take in this bigger picture of compounding barriers to health. When we have two or more hardships that are interacting, the layered impact can be even greater than the sum of the individual hardships. The COVID-19 pandemic has unfortunately provided us with many examples of this. So just for example, if someone were to be exposed to COVID and have to quarantine, that is certainly a hardship. They would, as a result, need to navigate the need to attend work and to school and obtain food, all without leaving their quarantine location. If
Right.
someone has no access to broadband, that is also a hardship. This person may need to go to a library or to a coffee shop, or maybe to a co-working space to fulfill work or school obligations, or they may be limited to in-person options for employment and learning. But if both hardships were to occur together, they would amplify each other. And so, as you can imagine, layered symptoms of disinvestment, like high rates of poverty or unemployment, all piled on top, would increase the impacts of these difficulties even further. Broadband access is powerful because it could reduce the current burdens and open the door for more resources to flow into a community, possibly alleviating other hardships as well.
And where can we find this measure on our county snapshot? Again, I'm telling folks we want to start with data so we know who is suffering, who isn't thriving. So where could we get this information?
Absolutely. The County Health Rankings and Roadmaps measure of broadband is defined as the percentage of households with broadband internet connection. And we've used data from the census to construct this measure. And you can find the data for your county on your county snapshot on our website at countyhealthrankings.org. We have placed the broadband access measure in the physical environment health factor area of our model in acknowledgement that the investment of physical infrastructure is necessary for access to be possible. It's also important to note that beyond the physical infrastructure, other reasons for lack of access to broadband include service affordability and personal interest. Our measure answers the question of access, but if you want to understand the reason why access might be higher or lower in certain areas, you might need to learn more about those individual communities.
Right. So how do we solve the issue?
There are a number of ways that have been shown to increase broadband access in unserved and underserved areas, such as grants and loans to internet service providers, to nonprofit utility cooperatives, and to local governments. We would like to invite you to visit our data spotlight to find resources to help expand broadband coverage in your community. County Health Rankings and Roadmaps offers broadband initiatives for unserved and underserved areas as a strategy within the What Works for Health library. Our analysts found here that broadband initiatives can support digital inclusion with efforts to provide low-cost broadband through the promotion of digital literacy, such as offering digital software and hardware training at convenient locations for community members, through efforts to support the availability of low-cost computers and technical support, and by establishing public access computing centers, just as a few examples. Providing access to affordable internet is a necessary first step for increasing adoption and meaningful broadband use in most communities.
Yeah, thank you so much, Christine, for just kind of laying a foundation for us about what this issue is and why we are serious when we say broadband access or broadband is a super determinant of health. So these resources that Christine has pulled together on this slide will be made available in your resource guide. And I do strongly recommend that you take a look at it because I know you are interested in figuring out what you can do about broadband access in your community. So Christine, hang on, because I know we're going to have some questions. But right now, I would like to invite Kiran back to the mic because Kiran is going to share some real life examples of how San Antonio is meeting this challenge. But first, Kiran, tell us a little bit about San Antonio. Like, what are a few of the city's highlights and what are some of the challenges that residents are encountering to be healthy?
Erica, this is my favorite thing to talk about, the first part at least, because San Antonio is my hometown. And it is one of the fastest growing cities in the country, especially among college educated millennials. We're home to the Spurs, as many folks know, and don't let anyone tell you otherwise. We have the best breakfast tacos in all of the land. On the flip side, we do have a lot of work to do. 1 in 3 folks in San Antonio are burdened by housing costs. 1 in 5 live in poverty, and just about 1/3 of our adult population has an associate's degree or higher in a community where nearly 70% of the jobs require higher education. The things that we are most proud of did not happen by chance. They happened because institutions worked together. So that tells us we can overcome the things we are less proud of, like the systemic inequities that have been compounded by the crisis, including digital access.
Yeah, San Antonio, I shared with Kiran earlier that my son and daughter-in-law are looking to move to San Antonio. So I hopefully will be able to visit the city very soon. But tell us a little bit about SA 2020 and why it's uniquely positioned to address health inequities in San Antonio.
Oh, sure. We are the nonprofit organization that drives progress towards San Antonio's shared community vision. We're born out of a community visioning process in 2010, led by then Mayor Julian Castro. The mayor's office knew for the vision to come to life, an independent agency needed to actively champion that shared vision, hold institutions accountable to it, and widely report on San Antonio's progress. So that's what SA 2020 does today. In fact, last year, in the middle of the pandemic, we led the process to reaffirm and strengthen the shared vision for another decade, setting the precedent that every 10 years, San Antonians will come together and envision a better future. The shared vision is made up of 9 community results, spanning everything from education to transportation, arts to economic development, and neighborhoods to health. To give you a sense of just how much ambition is embodied in these community results, I wanted to share more closely the vision for health. It calls for us being the healthiest in the country, both in terms of physical and mental lifelong well-being. The shared vision, however, is significant not just for what it says, but for what it pushes us in the community to accomplish together. These big, bold efforts are just some of the accomplishments from our first decade of progress. Enroll SA was one of the first efforts people organized for after the 2010 original community visioning process. And in just 1 year, we saw the highest number of enrollment in healthcare planning in the country. At Team SA 2020, we have a unique bird's eye view of San Antonio. We know about these efforts because we partner with more than 170 multi-sector organizations, including nonprofits, foundations, government agencies, companies, and more. They share their organizational impact with our organization, and we use that information to tell a more complete story of San Antonio's progress. In addition to tracking the landscape of work across our partners, we track more than 60 community indicators.
So I know that digital equity is definitely something that you all are tracking. What's your goal for it?
That's exactly right. Improving digital access is one of those 60 community indicators. And the indicator was added as a priority in 2015 when we realized the significance of digital equity to every aspect of the shared vision. Today, the goal is to increase the percentage of homes with computer and broadband internet connection to 100%. This indicator uses data available from the census, and it measures 2 elements of access to neighborhood infrastructure and access to devices. I share this because it shows why it's so important to know that the data does not tell the complete story alone. We know that digital access requires, in addition to the infrastructure and the device, it has to be affordable, and people have to have the knowledge and the skills in order to use it.
So, Christine was talking earlier about redlining and how that kind of really set the stage for digital redlining to be added on top of it. So, we see that neighborhoods that were challenged with this redlining beginning are also the same neighborhoods that are challenged with broadband access. Does this hold true in San Antonio as well? I mean, are these the same neighborhoods that are challenged with other inequities?
It does, Erica. I'm really grateful for Christine's presentation and to get to follow it exactly because she prioritized for us and helped us understand this history. The San Antonians who are most hurt by digital inequity live in City Council districts 1 through 5. These districts reach San Antonio's east side, south side, and west side. And in San Antonio, we cannot talk about geography without talking about race. These districts are largely home to Black San Antonians and Latinos, including seniors, workers, and young people who disproportionately are hurt by compounding inequities. These include health access, housing affordability, food security, higher education, underemployment, and mobility. To make sense then of San Antonio's inequities, we have to understand the history of institutions and race. These are San Antonio's redlining maps from 1935 to 1936. And the neighborhoods coded as hazardous are the neighborhoods that historically were disinvested in. Redlining was race conscious, specifically leaving Black San Antonians and Latinos out of those investments. So our solutions to advance equity have to be race conscious as well.
Right.
This is then in part why we disaggregate the data wherever possible and ask critical questions of it. Here, for example, we can see that white San Antonians have the highest digital access compared to Black San Antonians and Latinos. We can also see that the margin of error for this data, the green lines running at the top of every bar, are pretty significant for people of color that make up a smaller portion of San Antonio's population, including Native Americans, and therefore an even smaller sample size in the census data. This means that the disaggregated data is, again, we can't stress it enough, just one way to begin telling a more race-conscious and systems-focused narrative about progress, but it is not complete on its own.
Yeah, and I'm so glad that SA 2020 is really tracking what can be done to close the digital divide, and there are some local partners that are actually taking steps to make this happen. Can you share a few examples?
Absolutely. The monitoring their work is part of our bird's eye view at SA 2020. And I mentioned earlier, 2015 is when we began adding it as an indicator in our annual tracking towards the shared community vision. That same year, the Digital Inclusion Alliance of San Antonio was formed. This was the first cross-sector collaborative that was raising awareness about what access means and actively working towards shared goals. That same year, our public transit agency, VIA, became the first large public transit agency in the country to put Wi-Fi on every bus. We believe that because of this prioritization in 2015, it allowed many institutions in San Antonio to swiftly respond at the start of the pandemic. One of our independent school districts, one of the largest in the heart of San Antonio Independent School District, they took their 5-year plan and rolled it out within 5 weeks, beginning in March of last year. Alamo Dome and VIA, they turned their Wi-Fi networks outwards, creating hotspots where folks could be close to those spots and be able to access the Wi-Fi. Obviously, of course, not nearly enough. We have such significant work to do, but we have made progress in both raising awareness and incrementally working towards our goal. Today, San Antonio Digital Connects is a multi-sector collaborative that continues to raise awareness about what access is, and it's competing for federal and state funding in order to reach that goal of 100%.
Excellent. Many of our viewers are probably wondering how they can engage partners across sectors to improve broadband access. So, Kiran, would you be willing to share a few key steps that they can consider a network?
Yes, and we really summarize it often at SA 2020 with these 8 words. One of the greatest takeaways from the first decade of progress is the significance of being results-driven first and data-informed second. The data we have found over and over again is only as important as the result that you're seeking to achieve. And the vision, the specificity, of that goal is really critical. People-powered means we do this work at the speed of trust. Relationships are key, and so is respecting the knowledge and expertise across the breadth of traditional organizational hierarchies and power. Simply put, people who are most hurt by problems have the most knowledge to solve those problems. And systems-focused means we understand that inequities are not the result of human behavior, rather policies and budgets and program decisions that have historically not served all San Antonians. So in order to reach the shared vision, we amplify and advocate all the time that we have to examine our spheres of influence and control and recognize all the ways we are a part of the systems that we're seeking to change.
Wow, I couldn't have said it better. So thank you so much, Kiran. It has been worth the wait to get you featured on our webinar. Of course, stick around because we have questions for you as well.
Thank you, Erica.
Oh, you are so welcome. But now I want to hear from our audience. I'm curious if your understanding of broadband access and how it determines health has changed. So I'm going to ask Aaron to launch a poll right now. And if you would be willing to share if your understanding of broadband access has significantly improved, like where on the spectrum do you fall? This is an anonymous poll. We're not sharing the results with anyone. It's truly just for our own selfish evaluation. We want to know whether or not we were able to share learnings with you today. So please respond to that quickly. And Aaron, I'm going to ask that you just close it in 5, 4, 3, 2, 1 seconds. So thank you so much for participating in that snapshot poll for us. So with that, I want to turn it over to Joanne because I know we've got some questions that have popped up in the Q&A box. And Joanne, if you'd be willing to just take it away, I'm going to grab some water.
Thanks so much, Erica. Yep, we'll give you a quick break. And I want to thank folks who have been engaging with us in the Q&A box. Molly Burdine with the County Health Rankings team has been helping to answer specifically some of the questions that were related to some of the rankings data. So I'm going to start off with Kiran. There were some questions for you, and some are very specific. So, you know, if we need to direct folks to another place on your website or something, we can certainly do that. But you had mentioned 60 indicators that SA 2020 uses, and I'm just wondering if there's some place that folks can take a look at those indicators.
Yes, for sure. At sa2020.org/data, you can see the 9 community results. And then from there, you can see each of the indicators that we track to show progress towards those 9 results. January of every year is when we refresh our data dashboards. And so by the end of January, you will see the most up-to-date information that SA 2020 has.
Great. And folks, the website to SA 2020 will be in your resource guide, but it's probably already been dropped somewhere in the chat. I've just been glancing at the chat, and you all have been great about sharing resource links. And so Erica, before I move to the next question, I think I do want to go ahead and encourage folks that if they see a particularly compelling link in the chat box, that they should go ahead and click on it, so that they can save it, because we do not save every single link that attendees share in the chat in the resource guide. So make sure you pull that down. Yeah. Okay. And Kiran, this one's for you as well. But you know, I think what you presented and all the things that SA 2020 has been doing for the community really got people to thinking. And someone was just wondering why on one of the slides, it seemed as though areas that had better insurance coverage were the poorer neighborhoods. It was just sort of a reflection they picked up in the slide, I think.
Sure, I'd have to go back and look at it, but it in part could have to do with part of the advocacy that I shared about in terms of Enroll SA that occurred during the first decade of progress, included advocacy for seniors in San Antonio. And so there could be, what you might have been seeing was a relationship between our senior population or our elder population in San Antonio, and also the concentration of those in communities that are poor.
Great, thanks so much. Erica, we have time for a question for Christine?
Absolutely.
Okay. Welcome back, Christine. You know, there were a couple of questions related to the definition of digital redlining. And along the lines of, is there an official definition? Is the definition from the National Digital Inclusion Alliance one that is good to use?
Thanks for that question, Joanne. We have been using the definition from the Robert Wood Johnson Foundation. I'm not familiar with the other definition that you had just mentioned, but according to the Robert Wood Johnson Foundation, digital redlining is when major network providers systematically exclude low-income neighborhoods from broadband service and deploy only substandard low-speed home internet.
Great, thank you so much. Here's one I think that Christine or Kiran, maybe we can just sort of hear your thoughts about this, but a few people in the Q&A box pointed out that yes, access to broadband is one thing, but also wondered about strategies available to provide or increase access to the actual tools you need. Once you are able to access broadband, so things like increasing affordable PCs or laptops to access high-speed broadband, and that type of thing. I don't know if either of you have some thoughts or ideas around strategies there.
Sure, I can jump in first and then pass the floor to Kiran. Within the What Works for Health strategy that we have put forward, and I would encourage you to dig into that a little bit deeper and really get the wealth of information that our analysts have shared within that strategy. One of the approaches that has been found to be effective is supporting the availability of low-cost computers, and of course some technical support along with that as well, and also to establish public access computing centers as another approach if that happens to work better within your setting. Both of those have been supported by evidence to be effective.
Kiran, do you want to jump in here?
I don't have anything to add. What Christine shared is perfect.
All right, thank you. So I'm looking, there are still some questions coming through, and I will say that, you know, some of the questions are formed more as ideas that people are putting in for potential solutions, which is great. All right, I don't know if Christine or Kiran, you can speak to sort of broadband access as it relates specifically more to health and telehealth. Are there any special considerations that folks should think about in that arena?
Sure. I would say our advocacy has in part really centered on even what's embedded in the question itself. The answer being within it is recognizing the relationship of impact being interrelated. So a lot of our work at SA 2020 is to show folks the relationship between health and the economy, health and education, health and neighborhoods, including digital equity and access. And we have found the more awareness building that we can do about impact being interrelated, particularly among decision makers for both policies and budgets as well as programs, it aids in increasing the collaboration for things like healthcare providers to partner with our public transit agency that has prioritized Wi-Fi and the availability of Wi-Fi through its own networks, as just one example.
Great. Thank you. Here's a great question for both of you. Jeff is curious, what types of policy changes have you both seen or utilized with local and state governments that could be effective in bringing about expansion of internet access?
What comes to mind for me is just where I landed on the presentation, which was the awareness of digital equity and the compounding effects of the pandemic on San Antonio's existing systemic inequities has meant that there is part of the work that's happening around the cross-sector collaborative in San Antonio is to advocate for funding among any relief funding, whether that's at the federal, at state level, and to really insert within that advocacy work the significance of digital equity to any other aspect of COVID relief and recovery.
Thanks so much, Karen. Christine, do you want to jump in here?
Thanks for the invitation. I don't have anything additionally to add.
Okay. Great, thanks so much. Well, Erica, there are, lots of comments in the Q&A box, and I know we need to move on because you've got some exciting things to tell folks about as well. But I do want to invite those of you, if your comments or questions were not addressed here live in the webinar, please come on over to the post-webinar discussion group, because I think some of the things that you all have offered in the Q&A box are really more conducive to some back and forth and dialogue, especially with other audience members who are in communities and are addressing this issue and might have some really good solutions too. So we're seeing things, like what about the tools you need once you have access to broadband? How do we make it affordable? How do we partner with nonprofit and government? And again, I just feel like there are folks in this audience who, if they come over to the discussion group, we can hear from them too about some of the potential solutions.
Yeah, I mean, I think this is the start of a great discussion that you'll be able to facilitate, Joanne. So yeah, stick around for that. Joanne, thank you so much. Joanne's actually going to probably pop out to open up that discussion room where we'll be joining you shortly, Joanne. So please share your thoughts on today's webinar. Tommy is sharing a link to a brief evaluation in the chat. And, it would be terrific if you can click on that link and then complete the evaluation after the webinar. I want you to know that we really, really listen to your feedback, because we use it to improve our webinars, and we thank you for sharing your thoughts with us in advance. We actually use your feedback to help with content too, determining what it is that you all want to hear and learn more about in your work. So I appreciate you filling out that survey. And some of you have been with us for a long time, but I want to offer a special thank you to all of you who've been part of the CHR&R webinar family this past year. This is our last webinar of the year, so thank you for hanging in there with us. And to thank you for that. You are actually the first to get a sneak peek of what the 2022 season will look like. We will have a special webinar the day after MLK's birthday, the day after that holiday, to observe National Day of Racial Healing. So I'm going to tell you a little bit more about that and what that webinar is going to contain. But I also want to share that in February, we'll be hearing from a real public health hero, the American Public Health Association President, Dr. Georges Benjamin. And then next year, you can look forward to us having a webinar about how to manage myths and disinformation, because several of you as public health advocates have had to adopt that role, like had to take that on of how to manage that myths and disinformation. You found it to be a major responsibility over these past 2 years, actually. So we'll be talking about that next year. And then we're going to host a series on America's racial wealth gap and explore the effect that this gap has on everyone's health. We will explore community power in Native nations. And for the first time, we're going to host a webinar focused on environmental equity and justice. So I'm really excited about next year's season, and I hope you are too, and that we can count on you joining us starting in January. And with that, I want to tell you a little bit more about what that January 18th webinar is going to look like. I went to school at the College of Charleston in Charleston, South Carolina. So this story is kind of near and dear to me. But on June 17th, 2015, the world was rocked when 9 innocent parishioners, including an elected official at Emmanuel AME Church in Charleston, South Carolina, were murdered while engaging in Bible study simply because they were Black. And since then, the city of Charleston has been on this journey of racial healing. So join us on January 18th as we observe the National Day of Racial Healing by exploring the connection between racial healing and our health. We're going to hear from Hafiza Omar with Living Cities, who will introduce us to a curriculum that can guide elected officials and community leaders through a racial healing experience. And then we're going to talk to Amber Johnson, who is leading a reconciliation process in that city that's still grieving from its loss. Like, what does that look like and feel like? I don't know, but I hope that you'll join me next month to find out. So register today. You can register right now on our website. because you definitely don't want to miss this webinar. And also make sure that you follow us on social media. We're now on LinkedIn, finally. So make sure that you follow us on LinkedIn, and also be sure to sign up for our monthly newsletter. This is the best way to find out about our exciting webinars and all of our latest tools and resources. And as we wrap up today's webinar, I want to again invite you to join us to that discussion group you've been hearing us talk about. This is where we're going to explore this issue of broadband access, digital inequities, and digital redlining. We're going to really get into that in a conversation. And these conversations give you the chance to be face-to-face with other webinar attendees and share what you're doing locally, as well as ask questions of the participants. Kiran's going to be there. Christine's going to be there. Molly's going to be there. Molly can answer a lot of your questions about the actual data around broadband access. So Tommy has chatted out a link to that discussion group. When you click on a link, you'll need to answer a couple of registration questions, and then you'll receive another link to just pop right into that discussion group. And so I look forward to meeting you there. So thanks to Christine and Kiran for sharing their wisdom with us today. And to my colleagues, thank you for all of your assistance in producing these webinars month after month. But most of all, to our webinar audience, you all are doing the hard work. You're there on the ground, creating equitable solutions for your community. So thank you for everything that you do day to day. And I look forward to seeing you in the discussion group. And hey, I look forward to seeing you next year as we begin our 2022 webinar season. So have a good afternoon, everyone.